hello. Hey, I've got a quick video here for you. I'm going to go over the EMT practice test for chapters 1 through 5. You can find this document in Canvas. If you go into Canvas under the Modules tab, under the chapters 1 through 5, you'll find this practice test. So when we're looking through this test, I'm going to go through the questions and the answers and maybe talk a little bit about test taking strategies. Sometimes in multiple choice questions, the answers you'll find there's some that you know are definitely wrong, and there's some that you sometimes think more than one are right. So when you have two answers that both look right, you have to think which answer is the best answer, or which answer would I do first. And it can be a little challenging when you first start taking these tests, but towards the end of the class, you're going to get a lot better at it. So let's look at our first question, number 1. When you're transporting a patient with cancer, you inadvertently make an error and you give her an incorrect medication. You just weren't thinking. You reassess the patient and you note that her condition did not change. She remains stable. You should A. Notify law enforcement so they can file an incident report. No, that's definitely wrong. Exclude this intervention from the PCR because it didn't harm the patient. No, it's definitely wrong. We never exclude or omit information, especially when an intervention that we did. So that's definitely wrong. Next, we've got document the error and report it to the supervisor. Yes, you need to document it, and yes, you need to report it to the supervisor. So that looks like a good answer. The next, contact medical control and notify them of the error. Yes, we definitely need to do that too. So what is the best answer here? Well, I think when you're looking at this one, you've got to pick what's the best right answer, maybe what would you do first, and what's the best thing for the patient or for patient care. Now, just because you assess the patient and you note her condition didn't change doesn't mean the medication you gave couldn't have an interaction with her other medications that you don't really know much about, or that today or tomorrow or the next day there couldn't be an interaction or complication. So and maybe even though you note her condition didn't change, maybe something more complex could be going on. So in that case, the best answer is contacting medical control and notifying them of the error. We would do that first right away. Then we would document it and we would report it to our supervisor and maybe get further instruction from our supervisor. So correct answer is contact medical control and notify them of the error. Next, shortly after you load a patient, a 50-year-old man with abdominal pain, into the ambulance. He tells you he changed his mind and he doesn't want to go to the hospital. The patient is conscious and alert and he has no signs of mental incapacitation. You're suspicious that he has a significant underlying condition and you feel strongly he should go to the hospital. Which of the following statements regarding this situation is correct? So A, once he's in the ambulance, he cannot legally refuse. Wrong. That's wrong. He can definitely legally refuse as long as he is mentally competent and awake, alert, oriented ×4. A mentally competent adult can withdraw his or her consent to treat at any time. That is correct. Because of your suspicions, the best approach is to transport him to the hospital. No, even if you have suspicions, you can try to talk him into it. You could try to find out what his barriers are. You can try to get family and friends to help. All the things we talked about, the steps of a refusal, but you can't take somebody against their will, and they can withdraw at any time. A patient who refuses EMS treatment must legally sign a patient refusal form. Well, we do have a patient refusal form. We do want them to legally sign, but a patient can actually also refuse to sign your refusal form, and there's a spot for that where you would just sign. So the best answer here is B. A mentally competent patient can withdraw his or her consent at any time. It's important for the EMT to have a good knowledge of medical terminology. Why? Select the best answer. Perform and document more accurate patient assessments. Well, your patient assessment is really on what you're seeing and what you're looking and what you're palpating and what you're listening to with your stethoscope. And it's a lot less of making sure you use the correct terminology. So the terminology you use doesn't have anything to do with how detailed you can be in your assessment. Determine and document a more accurate diagnosis. No, I mean, we don't really document diagnosis. We don't diagnose patients. We can think of some things that maybe could be the diagnosis, like some differentials. So maybe, let's say somebody's acting confused. Maybe they're intoxicated from alcohol. Maybe they just had a seizure. Maybe they've taken some medications that are causing them to be confused. Maybe they hit their head. Maybe they're diabetic and their blood sugar is low. So those would be our differential diagnosis, but we don't actually ever diagnose. Communicate effectively with other members of the healthcare team. That's a really good answer. If we all want to kind of speak the same language and understand each other. And explain, more clearly explain to patients the nature of their condition. No, we don't explain to patients using medical jargon or medical terminology that they don't understand. We explain using clear and simple language. So the best answer here is communicate effectively with other members of the healthcare team. Okay, number 4, you're the supervisor in an ambulance company. The employee has sloppy, untidy, and incomplete patient care records. You're concerned about a risk because, in the eyes of the court, an incomplete or untidy patient care form indicates. So A, thorough documentation was not required. So here's the keyword required. So whether you document neatly or illegibly or tidy doesn't change what is actually required of you in the standards of care or your scope of practice. So that's not a good answer because of that word. Inadequate patient care was administered. Well, again, yes, if you didn't document it, you didn't do it. And if it's sloppy, untidy, and incomplete, it means that you didn't provide really good care in the eyes of a court. We talked about this in documentation lecture. So this is a really good answer. Potential falsification. Well, yeah, you should, it doesn't mean you're lying on the form because you're untidy, sloppy, and incomplete. Remember too, this incomplete word, if you didn't chart it, you didn't do it. An EMT was too busy providing patient care to fill out the form. No, too busy is never an excuse to not document. So this is the best answer. In the eyes of a court, untidy, sloppy, and incomplete care records means inadequate care was administered. While transporting a patient that's stable with an allergic reaction to the hospital, you come across a major motor vehicle crash involving several critically injured patients. So do you stop and triage the patients while your partner remains in the ambulance? No, because remember, once you pick up that patient, you have a duty to care for the patient, and if you stop and go somewhere else to take care of another patient, it's abandonment of your patient. So definitely A is wrong. Remain at the scene until law enforcement and other ambulance arrive. Well, that might seem like the right thing to do. You need to keep on with your patient and continue transporting. So this is the right answer. Continue transporting your patient and notify dispatch of the crash. And ask a bystander to remain with your patient as you treat the crash victims. No, that's definitely wrong. Although it may seem difficult to do, once you start taking care of a patient, it's your patient. If you find that you are the target of a patient's anger, make sure that you, A, are safe. Yes, good answer. B, do not take insults or anger personally. Yes, you can't take it personally. You're just going to treat everybody with kindness and compassion, and treat everybody equally and do your job and transport the patient and not take anything personally. That you're tolerant and do not become offensive, correct. So all of those answers are correct. Luckily, we don't have to choose the best one here. You're attending a patient who is involved in a car crash. He was not wearing a seatbelt when he ran off the highway and hit a tree. You correctly assume he has cardiac tamponade. On arrival to the hospital, the doctor determines that he needs to perform a pericardiocentesis. The suffix centesis means, so if we break down this word, we've got peri as our prefix, which it means around. Cardio or card is our root word, which is the heart. O is our combining form. And centesis is our suffix. So this is on your study guide of some medical terminology, prefixes, suffixes, and root words to know. Not the examination with an instrument, that is a scope or oscopy. Not suture repair, not pertaining to sensation or perception. It's pertaining to puncturing an organ or body cavity. So when you have cardiac tamponade, you have the pericardium or the outside layer of the heart, and blood builds up because of the trauma. Blood builds up in that pericardial layer and smushes the muscle of the heart so it can't expand and contract. And what the doctor has to do is cut a hole or puncture a hole in the pericardial sac to release that blood so that the heart muscle can adequately expand and contract. Okay, which type of medical direction do standing orders and protocols describe? So standing orders and protocols. So got to know this. We've talked about this several times. So radio, offline, online, and direct. Well, radio and direct, those aren't really things, so we'll ignore those. So we've got offline and online. Okay, standing orders and protocols are offline. So you need to remember that. If certain circumstances exist, like XYZ, then you can do ABC. That's offline. Online is when something falls outside of the parameters, but you think you need orders, so you call in to your base hospital, medical control, and you ask for orders. They give you orders. Those are online orders. So offline is standing orders and protocols. Online is when you have to call into medical control and get orders. So offline. Okay, an EMS provider who has extensive training in various aspects of life support, advanced life support, is called. Okay, so we've got the lowest level of care is the EMR, emergency medical responder. It's from first aid and CPR, BLS. We've got an EMT, which is the class that you're in, technician. We talked about how an AEMT or an advanced EMT has some additional training and some additional skills, and usually used in rural areas, and not a lot of programs and training, at least in this area. Paramedic, this has an extensive training, like 1,500 hours, so this is the right answer. Now, while there's additional training in the advanced EMT and the paramedic, extensive really is prompting you to pick the most training of all four of these answers. And which of the following scenarios involves the administration of ALS? So, a 48-year-old patient whose airway is secured with a supraglottic device. So supra means above, and the glottis is in your larynx, like by your voice box, that is really essential for breathing. So it's just above the glottis. So it sounds tricky in advance. So let's keep that as that's probably the good answer. 53-year-old patient who is assisted with prescribed nitroglycerin. Assisting patients with prescribed nitroglycerin is in your scope of practice as an EMT. 60-year-old patient who is receiving humidified supplemental oxygen. So providing humidified supplemental oxygen or supplemental oxygen either with nasal prongs or mask, humidified or not, that is in the scope of practice of an EMT. 64-year-old patient who is given aspirin for suspected cardiac chest pain. So scope of practice of an EMT, again, is giving aspirin for patients if you suspect they have chest pain of cardiac origin. So the correct answer here is A. This is an advanced life support. Okay, guys, there you go. Hope you liked the video, and email me as always if you have any questions.